Company Culture Change, an interview series by Mindshare Partners. Our goal with this series is to show the progress being made in the national movement for workplace mental health. In this episode, I'm really excited to speak with and introduce Dr. Alyson Smith. She is dual board certified in family medicine and addiction medicine and serving as the managing director of health and wellness for Delta Airlines since 2021. In her current role at Delta Airlines, she serves the 100,000 Delta employees and their dependents by ensuring access, equity, outcomes, experience, and quality in all of Delta's healthcare offerings. Thank you so much for being here today, Dr. Smith.
Thanks so much, Nina. Pleasure.
Awesome. So let's hop right into it. In 2022, Delta made some significant changes to its well-being program and created the Global Health and Well-being Division. Can you talk about Delta's well-being evolution and some of the benefits and programs you offer today?
Yeah, absolutely. To get there, though, I think it's important to note that I believe it's been part of Delta's culture for a long time. The health and wellness of our employees is sort of core to what we do. We think that it really makes that Delta difference, that we can take care of our people. They're going to take great care of our customers and our communities. And so, that this is where during COVID, when Ed Bastian, our CEO, brought Dr. Henry Ting over from the Mayo Clinic and his team to help with Delta's COVID efforts, it seemed like a natural next step, sort of part of the progression to then keep him on as what came to be the industry's first chief health and wellness officer. And then Henry built a whole team to work alongside him in this effort. He brought in data analysts, health researchers, physician leaders, nurses, mental health clinicians, benefits experts, and all of that team comes together and helps shape our health and wellness department today. And you mentioned a lot of changes, and I do think that really during this time, since about 2021, 22, Delta's made some of the most significant changes to its health and wellness offerings in its recent history. To do that, we really focused on specific key areas, and to get to those key areas, the things that mattered most, we started by listening to our people. We worked with our human resources department, along with our wellness team, to gather a lot of feedback from our people through a flourishing index, through surveys measuring employees' well-being, quarterly engagement surveys, all of these different tools, qualitative interviews, just listening to people to understand what they needed and where the biggest opportunities were. And so in that recent history that you were mentioning, or since 2022, our biggest initiatives have been in the areas of mental health care, fertility and family planning, and financial literacy and financial planning. And so that's where a lot of our biggest changes have been in the last couple of years.
Amazing. We also love that you are taking that tailored approach with your employees. We always say here that mental health is not cookie cutter. So
Right.
really great to hear that Delta is doing that. So your company leaders have also completed training to increase their awareness of mental health. What impact have you seen from that training? And is training a part of Delta's approach?
It is, absolutely. And especially around mental health, like you mentioned, nearly, I believe, 4,000 Delta leaders have since completed our mental health training. And we're looking to reach 100% of leaders by the end of this year. To do that, we partnered with the National Council for Mental Wellbeing to design a course that's really specific for our leaders. It's part mental health basics and part suicide awareness, with specific training to help a leader who's supporting someone in crisis. And we've heard from leaders that this training has really provided a lot of the tools that they needed to be able to help somebody in that time of need in crisis. And so I think that training, we've seen it translate to leaders now having that tool set, that comfort with knowing that they have the tools and the ability to help somebody if they were to come to them in that time of need. I think also that translates to this culture of safety, this psychological safety that we're trying to build within our teams. To say that, you're a leader that has this training makes, I think, employees feel a little bit better about reaching out for help, knowing that that conversation is there, that we're working to destigmatize mental health. Storytelling's also been a big part of what we've worked on, a great way to kind of normalize mental health issues. And we've partnered with our corporate comms team to really share employees' stories of their mental health journeys. But we know that to really, I think, reduce stigma, conversations really have to start at the top. And so during last year's Mental Health Awareness Month, I actually participated in a fireside chat alongside our CEO, Ed Bastian. And I've always known Ed to be incredibly smart and very well spoken, but I honestly didn't know what to expect when talking about mental health with our leader. But he was candid and very vulnerable, open in front of the entire company. And I think that takes a really strong leader. And it set the tone, I think, for others and a precedent that every employee can do the same. So starting at the top, sharing stories, and then training our leaders with the tool set that they need to be able to help somebody. I think all of that's gone a long way in our culture to help destigmatize mental health and empower people with all the tools that they need to be able to help someone.
Amazing. And storytelling is very core to what we do at Mindshare Partners too. So we have seen the impact in the reduction of stigma when leaders are willing to share their stories. So that's really powerful. And thank you for sharing that.
Yeah, thanks.
Awesome. So we talked about how your approach kind of focuses on different areas, physical, emotional, social, and financial well-being. Why did you choose these particular pillars?
I think it's just in recognition that we want people to bring their whole selves to work. To put safety first is our number one priority. So that means people have to bring their whole selves to work. They have to be paying attention. They have to be alert. They have to be caring for one another. And so, when that's our expectation, we can't really ignore any one piece of wellness and well-being. So that means more than just their physical health. They have, if an employee has an emotional health need, or if their family member does, for example, we know that they will maybe struggle to be fully present, to be able to care for others, to engage the way that we hope that they will, to look out for our customers, to look out for their teammates. We also know that every one of those pillars is hugely important. Social, for example, we know that strong social connections make for the happiest people, and I think we want the happiest people to be working at Delta. So we really kind of thought about this holistic wellness strategy, grounded in this belief again that if we take care of our employees, they're going to take care of our customers and our communities. So investing in this workforce holistically is really what's going to help to drive forward that Delta difference that we can bring to our customers.
Wonderful. And what are some of the ways that Delta's culture and your holistic approach support your frontline employees?
I think our culture it asks for us to really listen actively, to seek input regularly, to respond to our employees' feedback. Our employees feel really empowered to ask for help when they need it, to email Ed, to email their leaders and talk directly with them about concerns that come up. And so we get a lot of that feedback, and we really can then design better health and wellness opportunities for them based on what they're needing. And I don't know, are you familiar with that great illustration of like equity versus equality? This
Yes.
image of three people who are all trying to see over a fence.
Yes.
I think about this, like, that you've got one employee who's tall enough to see over a fence. As part of their job, they need to be able to see over the fence. The second one maybe doesn't have the height to do the same. The third's seated in a wheelchair and unable to see over the fence. And equality would be giving everybody a stool. And I think that the same is true for health and wellness tools, that if we, just give everyone the same thing, we may not meet the needs of our people. But tailoring and finding real equity in our offerings and our opportunities around health and wellness is really what we're focused on. So it may be, giving the stool to the person who doesn't have the height to see over the fence, but there may be another tool that you need for somebody who's seated in a wheelchair and unable to see over the fence. So we think about that when it comes to our front line. So I apologize, I'm rambling because it's a kind of given the backstory around equity. But this is really an important point because our front line is so diverse. Every one of our employees has such a unique job, and there's uniqueness in the actual job that there's doing. There's uniqueness in the hours that they work or the location, the region. You think about, the easiest one I think to think about is our flight attendants who are in the air for their work, but also in hotel rooms in strange places where they don't know people. So we have to think about how they can access our tools. So we've thought about things like, building access to mental health on site. We offer on-site mental health clinicians at 15 of our hubs directly in the airports. And that's a great way for people to eliminate some of the barriers traditionally that they see when they're trying to access mental health care. Difficulty getting to an appointment, difficulty, finding the time. And so we started there, and then we had to even expand those hours that those clinicians work. Our reservation specialists work shifts around the clock, and so we started offering really early mornings and late evenings appointments with our mental health clinicians. Our reservation specialists actually inspired us to think about nutrition in a different way as well. You think about equity. These are folks who had such busy schedules. They really struggle to get off campus to get healthy foods at lunchtimes and breaks. So we implemented improvements across the boards to our cafes, break rooms, vending to offer free fruit, free coffee, flavored water machines. We added a $5 and an $8 wellness meal so that healthy choices and healthy meals became the easy choice instead of having to struggle to be able to do that. Our emergency savings fund, we offer up to $1,000. Delta will contribute to an emergency savings fund. But in that, employees need to engage and learn some financial basics. And when we initially launched the program, we heard from our employees that it was really challenging to get to all the steps to fully fund that emergency savings account. So we simplified it. Again, we just recognize that every one of our employees has a very unique job, and the demands of that job are often enough that some of these tools are not going to be able to be available to them. So tailoring them, continuing to listen, continuing to change has been core to what we've been doing.
Amazing. Thank you so much for that detailed sort of insight into all those pillars as well. That was really
Yeah, absolutely.
interesting. And finally, what are you most proud of accomplishing when it comes to well-being at Delta?
That's a great question. I think that part of it is just this journey to shedding this light on wellness. Mental health has been a big part of that for me. We talked a little bit about training our Delta leaders, just getting the word out, sharing these stories. All of that, I think, has really moved the needle at Delta in creating this psychologically safe culture where people do feel comfortable talking about their mental health, asking for help when they need it. And I think kind of proof is in the pudding. We moved to a new EAP partnership in the last year in order to be able to provide faster access to mental health care, higher quality mental health care, and take away any of those barriers that people experience, like I mentioned, to accessing mental health care. And the statistics were really staggering. Just since we launched in September of 23, Delta's people have held over 27,000 therapy appointments. And in that first 90 days of launch, we saw more appointments completed by Delta's people than we had essentially in the entire year of 2022. I think it was a pent-up demand for mental health care, but also, we were successful in listening to people and what they really needed. They needed to be able to schedule appointments online, that ability to make appointments that are, with a clinician who's available within 24 hours most of the time can really make a huge difference. And our EAP partnership with Spring Health offers 24/7 crisis availability so that, anytime if somebody needs something, they've got that access. And I think also the ability to tailor and find a provider who's right for you by filtering, but based on preferences, makes a big difference as well. So we've seen huge success. I'm really proud of that. I think that will hopefully see some downstream effects of a healthier workforce, able, like I said, to bring their whole selves to work and lead healthier lives and taking care of their families. We offer EAP to family members, household members as well. So I think that's one of the things that I'm most proud of as far as what we've accomplished here at Delta.
That's amazing. Thank you so much, Dr. Smith, for being with us today and for all of the great work that you and your team are doing to care for Delta employees. We have viewers watching this that are also leading mental health work at their organizations. In a few sentences, what advice would you give them?
I think that it is critical to listen first. I think that that's one of the key things that we've learned at Delta. And one of the things that we really felt was, through the pandemic, the tendency was to do whatever you needed to do. And no, I don't blame anybody for doing that. I think that that's where we all were. We didn't know what we needed. Often the tendency was to add in vendors and to say, we need more point solutions. We need to solve for this. We're going to bring in a point solution. I think simplifying the landscape in healthcare has been successful for us at Delta too. We heard from people that, it's great we have all these resources. It's great that we have all these vendors, but it's hard to know where to turn. And the healthcare system is complex as it is. People don't always know what the best opportunity is to get the things that they need. And so for us, we heard loud and clear simplification, one entry, one door, listening first. I think it's our tendency as people who go into this field, we want to help. We're all, eager to do whatever we can to fix things. And I think, taking a step back and really understanding what the needs are can make a big impact.